Hello everyone, welcome back. Now we're going to be talking about the road to medicine. So the first video was the introduction, but this is where the real nitty-gritty starts. As you're all aware, applications start 15th of September and they actually close on the 15th of October. But you know, as well as I do, that the pre-application process started a long time ago. Now, what you need to realize is your grades are non-negotiable. The fundamental items you need to consider here are your GCSEs and your A-levels. As mentioned previously, those are non-negotiable. You need to aim for the highest grades you possibly can. If you look at your GCSEs, they are the only evidence universities have, as well as your colleges have, of what your predicted grades will be and what you can potentially attain. So you need to aim for the highest grades you possibly can. And you need to make sure you perform consistently high in your A-levels. Now, I'm going back to COVID times. When COVID came along, your predicted grades based on your mocks were of paramount importance because you couldn't do the actual exams. So you never know what's around the corner, so always continue to prepare as best you possibly can. You also need to gain essential real-world work experience, okay? And this is the cornerstone of all medical school applications. Now, people turn around to me and say, shall I go sit in a surgery? Shall I go shadow in a hospital? The fundamental thing here is you need to have reflective practice. So go shadow somebody, but then come back and think about it. That is what's going to stand out in your application. Not, I just sat in a dental surgery or a hospital, outpatients clinic, outside. You need to identify what you saw and reflect on it. Volunteering and extracurricular activities show diversity of your portfolio. Nobody wants an individual who all they do is study. Study by itself does not make you a good doctor, okay? What you need to have is a strong academic foundation. You need to have interpersonal skills as well as management skills, and that's where the extracurricular activities come in. Whether you play football, you know what, whether you do knitting, that's manual dexterity, crochet, you play cricket, you play hockey, you like computer games, you participate in esports, all of that is of fundamental importance. And also build up your intellectual curiosity. Read around. Do not just stick to medical texts, okay? Read around scientific journals, read around what the political landscape is, just widen your whole base of knowledge. Learn how the NHS works, when it was founded, what makes it tick, what are the evolutions in healthcare, what other systems are there on the planet which deliver healthcare. So think about all of these, and remember, you need to start early, be consistent, and reflect on everything you do. Your future self will thank you.